Sheffield City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Today, and it's how to avoid back pain, or what to do if you get it. Sorry.
Good morning everyone, my name is Gabe and I work in the Sure Cell Clinic in Pratt Soy 6. I've got a nice varied job, to say the least, here, trying to help people to understand about regenerative medicine, which is what the Sure Cell Clinic specialises in. But I'm also a physiatrist. A physiatrist is a person who basically is a physical therapist but with advanced medical knowledge. I also, as I say, I teach about diet and nutrition, because an awful lot of our medical problems today, indeed, are related to both diet and nutrition. So part of my talk today will be exactly that. I'm going to begin the talk by talking about back problems, and then at the very end I'm going to briefly go across what PRP is and what my clinic does, but it will be brief. How many people in the room have never had a back pain? So we've got about 4 to 5 people in the entire room who've never had a back pain. So it goes to show us how prevalent this subject actually is. Yeah. So, back pain is one of the most common causes of sick days, with up to 85% of the general population suffering from back pain at least once in their lifetime. At the moment, I was reading a stat last night that 540 million people at any one time will have back pain in this world. That is an astronomical. If you think of the amount of money we can tap into in the medical world trying to fix back pain, and frequently not actually managing. But part of that cause will be due to the people that we're trying to fix making no effort at all to try and fix themselves. They want us to do all the work. So there's many, many causes, but the most common causes will be sprains or strains. And the difference is that a ligament gets a sprain, and that's from being overstretched. But a muscle gets the strain, so you've got the sprain and the strain. And muscle weakness will be related to simple things like obesity, pregnancy, posture. Okay, so if you're sitting for 8 hours a day in front of a computer, there's a fair chance you're going to have neck and shoulder discomfort. Because again, most people will forget that the computer's at a lower angle, so you're looking down into the screen. All computers should be elevated, that you look directly up and into them so that you sit correctly at your desk. But how many people do that? Again, it's an occupational injury. Well done, Ryan. It's an occupational injury, but occupational, it should be somebody in your company's going around making sure your computer has a screen on it and your computer is elevated to the size that you can see straight through, plus your chair is anatomically correct. Bulging discs or herniation. Again, there's a lot of confusion about discs. People come in and say, a slip disc. A disc is like a jelly bean. It's got a hard outer surface and it's got a jelly inner surface. And the idea with the annulus, which is the hard surface, keeps the jelly in place. What does a disc do? It allows us to be flexible. It allows compression. So it's basically a shock absorber. But like everything else in the body, with time our discs wear. And what happens is the annulus will crack. So the jelly leaks out through the crack, and that can put compression onto the nerves which are running along the spine. This can cause pain for some people, and other people won't even notice they have it. When you get definite pain from a disc is when in fact the jelly dries out inside the disc, and then there's no longer flexion or compression. That causes pain. And that's the time that we have to consider surgery. Not for a slipped disc, but for when the actual crack is inside in the disc itself. The vertebral compression or trauma, age or osteoporosis. So basically, again, if you've been in a traffic accident or come off a motorbike, And if we were to take you an X-ray, you'll probably find that you have 1 or 2 vertebral compressions, meaning that the vertebrae have shrunk in size. Now the vertebrae on average are approximately about 1 inch to 1.5 inches high, depending. We have, of course, 26 bones, all movable in the spine, and then we have 5 compression. We have 5 compression. So I know this is very, very small, but it gives you an idea. So when I'm talking to people about their spines and they say, oh, I think my spine is out of alignment. Your spine is like a zip, okay? It knits together by the facet joints here at the edges. And zips, if they go out of line, you throw it out, don't you? It's not that easy to put a zip back in unless it's a metal one. Certainly not a plastic one. So all of these joints here basically stay in alignment. It is very, very hard to throw your back out. It really is very hard. But a lot of people feel they have it because they've got such severe back pain. The problem is that when you get older and you get arthritis in these tiny joints, these facet joints, the vertebrae no longer are smooth in their movement. And then we get pain. The way to stop the pain is so easy. It's from doing stretches. Now, if I was to say to everybody, I want you to do 10 minutes of stretches every single day, most people look at me and say, oh yeah, that's no problem. I'll ask them next week, did you do the stretches? I never got time. Time. My God. 10 minutes in your day. You didn't get time. Yeah. So this is when I say, in the world of health, people want us to do it for them. I can't do your stretches for you guys, I can only do it for me. Other causes include smoking. Why? Well, smoking reduces blood flow. And the blood flow then weakens your bone and slows down natural repair. And you're wondering, well, how does that happen? Everything in the body requires oxygen to survive. Your blood carries the oxygen and hemoglobin. Therefore, if you're a smoker and your arteries are constricted, many areas of your body are going to suffer. And one of them is the bone ends, the plates. And that's one of the new considered causes for osteoarthritis. Excessive weight. Your BMI should be between 21 and 25. BMI is your basic weight in your body. If it's over 25, you're in the obese range. And that's putting weight. So for example, for every 1 pound extra weight you carry is 6 pounds extra weight on your knees. It's a lot of weight. And I often think that when I'm carrying the shopping, and it's so heavy, and I'm thinking, my God, if this was on my stomach, is this how I would feel every day of the week? It would slow me down tremendously. Lack of exercise, again, a big problem for so many of us. We get used to sitting in front of children in particular, and Ireland is, I'm from Ireland, you'd not guess, but children in particular, in Ireland, 25% of our children under the age of 10 are now obese. They're not overweight. They're obese, and that's an absolute disgrace, that children should be obese. But they don't want to go out and play football. They want to play with their iPhones. It's unbelievable. Now it's an interesting little comment here I've put in that acid reflux and angina can also present as back pain. So again, in the medical world, it's important when we interview people, we don't need your x-rays, your MRIs, we need to talk to you first. And patients will come in to me all the time and say, can I have an x-ray? Why do you want an x-ray? What's it going to tell me? Is it going to tell me that you've got compression of vertebrae? You might have that 20 years, but if you're fit and you're stretched, it's not going to be a problem. I crashed a car 30 years ago. I have 4 compressed vertebrae in my spine. I have 3 discs gone in my spine. I have no back pain. Doesn't exist because I'm well and truly stretched. I have to be. My job requires me to use power. If I don't keep myself well, I can't help other people. Cancer is normally metastatic from another site in the body. So most times, as I say, it's going to be lung, it's going to be breast or prostate cancer. And that again will come into the interview that we're going to do to find out, have you any other problems? Have you had your bowel changed its habits? Has your bladder changed its habits? Because if the spinal nerves in the lumbar spine have been affected by cancer of any program, then that's what we're going to find from that. So it's very important that the person you're speaking to asks a full and complete history as to how long have you had the back pain, how do you think it happened? So yeah, sure, I picked up a box, or I picked up the groceries, or I slipped on wet floor. That's easy, that's probably a muscle sprain or a strain, and when we examine your body we're going to find that. But if you turn around and say, well, I woke up the other morning and I had back pain and I just never get rid of it, then I want to know, is it the posture you're using to sleep in? Do you sleep on your tummy? Because it's one of the worst postures for a back. 14% of us sleep on our stomach. It affects your neck. Do you sleep on your side in the fetal position? Again, if you have back pain or you have a history of back pain, you should have a pillow between your knees. That keeps the spine in alignment. So these very simple things can help to keep you out of pain. Okay, I'm not going to change this. Anybody know how to get this to work for me? Oh, haven't. Maybe I turned it off.
Can we just interrupt you?
Yes,
We've got
of
this
course.
video before 11 o'clock.
Of course.
So as Jim said, we'd just like to play this video, and then at 11 o'clock I'll ask you to observe a minute's silence.
In Flanders fields the poppies blow, between the crosses row on row that mark our place. And in the sky the larks, still bravely singing fly, scarce heard amid the guns below. We are the dead, short days ago we lived, felt dawn, saw sunset glow. Loved and were loved, and now we lie in Flanders fields. Take up our quarrel with the foe. To you from failing hands we throw the torch, be yours to hold it high. If ye break faith in us who die, we shall not sleep, though poppies grow in Flanders fields.
Please join me in a minute's silence. Thank you. Thank you, Gary. Sorry about the interruption.
Never a problem. Not when it's for a good cause. Okay, so now we're getting on to the more difficult words for those of us who don't like spelling. Spondylosis, which is spur formation normally caused by a form of arthritis. Spinal stenosis, which is narrowing of the canal that holds your spinal cord. Ankylosing spondylitis is where the joints themselves will fuse. As I explained earlier, the small facet joints, each side of your vertebrae, they're synovial joints, so they rotate, they flex, and they allow us full range of movement. With spur formation or with ankylosing spondylitis, they can fuse, and therefore you can't move as freely as you did, and that's very, very painful. In the skeletal deformities, you've got kyphosis, like the dowager's hump. Think of Notre Dame and the hunchback. And then you have scoliosis, which is curvature. Now, kyphosis, the most common cause for kyphosis is actually osteoporosis, which is where is calcium deprivation in your bones, and that will cause this dowager's hump. However, we are also fighting with schools throughout the world to try and get rid of school bags full of books and to get kids onto iPads, etc., etc. Because these school books are causing major back problems for these kids, and we're getting pain in children from the age of 12 up from carrying ridiculous amounts of books to and from school. But that's been something we've been fighting for years. The scoliosis is a genetic problem where you get a curvature of the spine. Again, it seems for some reason to be on the increase, and we're looking at diet for that. There are some treatments you can have, but one of the most effective treatments is if you identify it in a child at an early stage, is in fact exercise programs in order to keep that spine straight. As the stronger the ligaments are each side of the spine, the better chance you have of keeping the spine straight. But there are treatment programs available to help to keep the spine straight now, but you need to be identifying them when the children are like 8, 10 years old. So exercise is going to be through low impact exercise. For example, walking, swimming, cycling, yoga. And that's why we have Diana Montanas with us today, because she's going to show you the few stretch exercises that I do ask my clients to do. I don't ask for a lot, because I know people won't do them. So I tend to give you 2 or 3, and that's it. And I do ask they to be done. Now in walking's great, but do remember it's an impact exercise. If you do not have the right shoes on you, don't go walking. So don't go walking, for example, in the flip-flops. Total out and out disaster, there's no support. You need to have shoes that have a heel on the back of the shoe so that your foot is held properly by the shoes. So trainers are the best way forward, and good trainers. Swimming, again, breaststroke has been proven to be quite damaging to the back for the older person. So you're better with front, forward, back, cross. Okay? Cycling, the one thing we recommend in the SureCell clinic is to have a recumbent bike at home and to do 5 minutes 3 times a day. It's not too much. A recumbent bike is basically an exercise bike that you have at home. If you're quite happy to go out on the Pattaya roads, which I have to tell you I would not be, then yes, that's a great form of exercise. but you're taking your life in your hands every time. And then yoga is obviously an absolutely tremendous way in order to keep stretched. Focus on building up muscle, but avoid the bodybuilder look, because your short muscles will tear. Long elastic muscles are both strong and flexible. So when you see these guys walking in and they're wearing these ridiculously tight little tank top t-shirts to show off their wonderful biceps and triceps, and they think we women love it and we don't, they're the guys who can do very little because they're not stretched. They're just tight, and they're like little bulldogs walking around the place. Instead, we want you to be flexible. Okay, much better flexibility, isn't it, ladies? We like flexibility. Okay, we want diet and nutrition. I want you to stop smoking. Avoid bed rest. 30 years ago, the first thing we would have said to you is go to bed for a week. Relax. Don't move. It'll all go away. We don't do that anymore. Straight away, we'll tell you to do things like have an Epsom salt bath, but unfortunately in Pattaya, very few people have a bath. So the next thing we'll ask you to do is heat and ice. So again, you have to get a hot water bottle, imagine, in Pattaya. But yeah, heat and ice. Why? Heat makes the blood rush to that area because it's attracted to the heat. And then when you put the ice on it for 10 minutes, it rushes out the lactic acid that may be there launching, causing that pain. And non-steroidal anti-inflammatory drugs like Brufen, for example, or Tylenol, be very careful when you're taking these drugs, particularly if you're on other medications. So don't just decide yourself, gosh, I have a pain in my back, I think I'm going to go off and get some Difene. If you're on other medications, many of these non-steroidal anti-inflammatories cannot be taken with other medications. So please be very careful about that, that's important. So the one I recommend to my patients is actually diclofenac spray. It's called Uniren and it costs like 180 baht, so it's cheap. And because it's a spray, you spray it onto the affected site. Within 5 minutes you get pain relief. So your stomach is not going to be irritated by Difene, which is one of the things it does do. So I really do recommend, if you have pains or aches, Uniren spray for me is the one I recommend for my patients. Physical therapy, this is where I'm going to come into play. Physical therapy is where we're going to use some electrotherapy, we're going to use some ultrasound, and we're going to use some stretch exercises and deep tissue manipulation. It's not comfortable, but it works. And most times, we only need to see you 2, maybe 3 times, and the problem's resolved. But it'll only resolve if you do what I ask you to do, which will include things like drinking plenty of water and doing the stretches that I'm going to show. Tummy tightening. So looking around the room, there's a few of us could do with some tummy tightening. Pelvic tilts, knee to chest, lower trunk rotation. On the table here at the back, I have left a little sheet. And on the sheet are these exercises. So Diana is going to do me the favour of coming up here now, and she's going to show you how to do these stretches. They're so easy, but please, if you have scoliosis or you have any actual abnormality of your spine, be very careful doing these exercises. You'll know yourself what you can or cannot do. If you've got scoliosis, for example, you should not be doing spinal rotations. Okay? Just don't do them. 2 chairs probably do it. You all know Diana Montanas. She's spoken to us a few times. Diana specialises in yoga, and she's now doing a lot of teacher training. Very successful lady here in Pattaya, and she's one of the people who, when I have patients whom I know cannot do exercises on their own because they're just not motivated, I get them to call to Diana, and she'll go to their house, or they can go to her clinics, and she'll take care of them. And every patient comes back and says she's wonderful. So if it helps, that's great. Okay, Diana. Yeah, whatever. Yeah, okay. Diana wants to start with an exercise which we call cat-cow exercise. So you're going to be on all fours, okay? Making the weight distribution equal on your knees, so your knees are hip width apart, and your shoulders are shoulder width apart. Okay, Diana, we're going to do the cat. So breathe in deeply, Bring your spine up into a curvature. So we're opening all these vertebrae here. Okay, now relax, breathe out, and bring your spine down, and release. Now we're going into a hoop. So again, we're opening all these spines, but closing this in the spine. The breath work is very important. So when you go into the cat, you take a deep breath in, and then when you go into the cow, you take a deep breath out. Very good. Okay. Now Diana, lie on your back for me. Diana likes this one. I actually believe that before you get out of bed in the morning, you need to do a knee hug. Okay? So a knee hug is very simple. You're going to take right or left knee first. Okay? You're going to put your hands underneath the knee so that it's supported, and you're going to give your knee a nice little chug up to your chest. Now when I ask my clients to do this, most of their knees get about this far. Okay? They're so badly stretched that the hamstrings don't come with us. The gluteal muscles, which is in your butt, don't stretch. And then let that down. Now we do the other side. So when you're hugging this knee, the other knee leg is straight. Give it a hug. Now Diana is not 21, 31, 41, 51 or 61, and she's very mobile. This is how I'd like people to be, because you're not going to have back pain. Okay, release. And then take the two knees together and give them a hug. Keeping your neck and shoulders down all the time, don't bring your head up. Okay? What this is doing here is it's opening up all these muscles. It's stretching out your lumbar spine, which is where most of us get pain, is in the lumbar spine. If you can do this, which takes a few seconds before you get out of bed, before you put your feet on the ground, you've automatically woken up your spine after a night's sleep. Okay? So that's going to help in itself. Thank you, Diana. That's great. Okay, so on the next... About 5 seconds. Yeah. Yeah. Okay, just stay there, Diana. Okay, so the next thing we're going to do, we can't do it in the chair, but we'll do it one way, is the low back rotation. So you're going to lie down flat on your back. You're going to take your knees up like this, lovely, and you're going to take them to the side. Okay? Your shoulders, again, are on the floor. Okay? But your knees have now rotated down to the left side. Please do not do this if you have fusion of your spine or if you have scoliosis. This is giving us a lumbar spine stretch here. Most of my exercises are focused on lumbar spine because that's where most of the pain for people is. Then you'll bring the knees back up into the rest position, and if you didn't have this, we would drop them to the other side. As I say, I have left one of these on the back table. There are pictures to show you what we ask you to do, and 5 seconds per pose is approximately good. A maximum of 7 to 10 minute stretches every day will help to prevent back pain. Okay, now Diana, we're going to do the pelvic tilt exercise. So on the pelvic tilt here, again, you're just going to lift up your pelvis as high as you can, put your arms underneath for support. Now Diana is particularly flexible. I would not be expecting most of you to survive this here, but that's a really good pelvic flex, okay? Even, I don't know if I could do that myself. But we're looking to get you up so that we're getting flexion in your spine. And release. Perfect. And now you're going to push your pelvis down into the chair. Yeah, so you're going to push. Perfect. Lovely. We're going to do the bridge exercise. So the bridge is much the same, except you don't have to go into, sorry. No. Normal. No. No. No, I have it here. Okay, so we've already done the cat. And the last one I want to show here is the seated low back rotation. No, seated. So this is for people working in offices. If you have back pain and you work in an office, the rotational stretch, so cross your leg, okay, and rotate the other way. That's it. And rotate this way, that way. Now, so you're crossing your leg to the right, you're rotating to the left. You're getting a spinal stretch, nice stretch. So if you're sitting in a chair for a long time, that in itself is a lovely stretch. As I say, 7 minutes. Thanks very much, Diana. These are in the back. Please help yourself to one. These are simple stretches. You cannot hurt yourself if you do them properly. And it might make all the difference to you as far as pain is concerned. There are certain vitamins that you can help yourself to help. Now, vitamin D has had a lot of good press and bad press. If you're from India, there's a guarantee you're going to need vitamin D, which is quite amazing because you're in the sun. Vitamin D is a natural vitamin that the sun changes with our skin. But in Asia, believe it or not, it's actually quite low, and vitamin D is responsible for causing problems with the bones. So by taking a supplement of vitamin D, if you take a low-level supplement, it can help there to absorb calcium, iron, magnesium, phosphates, and zinc, which helps bone health, helps anti-cancer properties, cognition and dementia, and strengthening your immune system. Then there's coenzyme Q10, which is fat-soluble antioxidant. Again, it helps with blood pressure maintenance, which in turn will help with your bone health and brain health. And finally, magnesium, particularly for us ladies. Magnesium is essential for the uptake of calcium in the body. If you buy a fortified milk, it will have calcium and magnesium already in it. That's really important. So magnesium here, you can buy it in a spray from Pascal in Health Hub. And it also helps people to sleep at night. If you spray it on the soles of your feet, it helps people to sleep. So present in food mainly. So you want to eat beans, legume, nuts. It's used in developing bones, synthesis, DNA and RNA, nerve impulse conduction, muscle contraction, and normal heart rhythm. So we're looking to deal with back to the blood again, because we're looking at end plates and the blood supply to your bones. Type 2 diabetes, important role in glucose metabolism. Osteoporosis, because of the absorption of calcium, and also useful for migraines. So as we started the talk, I told you that I work for a company called SureCell, and SureCell is a regenerative medicine company. We have businesses in Australia, Bangladesh, Canada, Malaysia, Thailand, India, and Fiji. And this is the clinic here in Pratt & Size 6. It's a nice, big, fresh, clean clinic. All the staff speak English, and we offer a full GP service. So for example, if you need your driving license certificates, it's 200 baht, which is probably one of the cheaper ones around. And the staff all speak perfect English. Nice big clean clinic. So just behind the Ayara Hotel, Pratt & Size 6. And there in the clinic, we do therapeutic PRP, which I'm going to explain now, stem cells, supplements, hormones, so testosterone levels, etc., lifestyle changes, exercise, diet, physiology through knee, we have hyperbaric chambers and care plans. So PRP, what is it? PRP is platelet-rich plasma. Platelet-rich plasma is you healing you. We don't add medications, we don't add hormones, nothing to it. We take a sample of your blood, we centrifuge the sample, we take off the platelets. From that, we get rid of the red cells, we don't need them. Then we put that through an accelerated light program, which wakens up your growth hormones, which went to sleep when you're about 18 to 22 years old. The statistics will show here that if you have PRP versus cortisone, the cortisone will wear off quite quickly. The PRP will last much, much longer and give you long-term benefits. In platelet-rich plasma, after we've put it through the light program, we have increased the endothelial growth factor, which is for endothelial cells in the body, by 6 times. 48 times increase in fibroblasts. Fibroblasts are the little cells in your blood that heal. So when you get a cut and you see all those little clear cells, they're fibroblasts. And then platelet-derived growth factor. So you're healing yourself. In the audit results, It shows that nighttime pain is halved on average. Females would have an 80% improvement, males 74%. In the age group of less than 50, it's 83%. In 50 to 70, it would be a 76%, and a 70 plus would be 79%. Now, when we use PRP, you can see this is for back pain. Most people come to the clinic for PRP in the knee, because that's where the majority of people will get arthritis first. You get it in the hip as well, but the knee might be the first one to go. And we can have an 80% success rate with knees and PRP. If people come to us when the pain starts fairly early, and it's a grade 1 or 2 arthritis, meaning there's a bit of wear, but it's not extreme, PRP will work, and it's cheap, okay? It's 5,000 baht for the injection, and you need 3 injections, so 15,000 baht. I have today with me a gift voucher for anybody who's actually thinking about using, thanks Diana. If anybody wants to come to me later or to Judith, I'll be leaving these. These are gift vouchers to allow you to have 1 free treatment in the clinic. That's equivalent to 5,000 baht. And it allows you to try it out and see, is it going to work for you? As I say, we do knees, we do hips, we do shoulders, tremendous for tendonitis, golfer's elbow, tennis elbow, fantastic, it really works well. But we also do what they call parafacials. So we do your face with the PRP, and what it does is it helps to stimulate your collagen and your elastin levels in the 5th level of your dermis to be ignited, okay, they've gone sloppy with age. So we're trying to remind them of what it's like to be young. You won't look 20 years, 30 years younger. It's not Botox, but you will get a glow, okay, you will look healthier. This is a patient of mine who came to the clinic a year ago. He had been 20 years in a wheelchair, not able to walk, not able to feed himself, able to do very, very little for himself. Came to the clinic for 1 month. He stayed for 11. By the time he decided to leave, he could walk with a walking frame. He could swim 4 lengths in the pool without a life jacket. This is my husband, myself. This is a tremendous success story, this chap. As I say, when he came to us, he was in a wheelchair. Within 6 weeks, we took him out for dinner one night, and he said to me, "Gay, can you open my water?" And I said, "Why, what's wrong with your own hands?" And he looked at me, and my boss is across the table, and he's thinking, bitch. And I said, I just looked at him, I said, open it. He did. He picked up that bottle, he unscrewed the lid, poured the water, put the cap back on, and he smiled. And that was just such an incredible smile. And he just looked at my boss and he says, "I haven't done that for 20 years. Okay, so it was self-empowerment as well. I'm not the easiest person to work with. I like you to work for yourself. But that guy went home able to walk with a walking frame. He ran out of money. He'd have stayed for longer, but unfortunately it's not cheap. We do have a new form. We have 3 things we do. PRP is one. We do fat cell therapy as well. So if your knees are bone on bone, your hips are bone on bone, worn out cartilage, gone, and you happen to have an inch or 2 extra on your belly, we will take some fat via liposuction, which doesn't hurt, off your stomach. We will do the same as we do with the blood, centrifuge it and take the good stuff off. And then we inject that into your joints, and it's seriously, seriously powerful. It really works very well. We will store fat for you so you don't have to have the lipo again for up to 1 year. So if you find that after 6 or 7 months you know what to do with the top up, you just need to come back into the clinic, we'll take it out of the freezer, you get your top up. It's a bit more expensive, it's 65,000, so it's more expensive, but it can stop you needing a knee replacement or a hip replacement for 7 to 10 years. The latest one is called XL therapy. Now this is expensive. This is 130,000 baht. This is expensive. But this is supposed to be the cream of the cream. What we do again, we take about 20-25 tubes of blood, and it takes us 2 days to prepare your blood, and then we give it back to you intravenously, plus in any specific joint you have a problem with. It works tremendously well. but because of the cost, it's not the most popular. Okay, we would get a lot of people coming from Saudi Arabia, a lot of people from India for this treatment. But here in Pattaya, as I keep reminding my boss, most of us are retired and on pensions, and 130,000 is a lot of money. But it does work, it's tremendous. So if you've got early arthritis, grade 1 or 2, let's try PRP first. If you've grade 3 or 4, we might think of doing flats next, because it's not as expensive. But if you do have the cash, then this one here is definitely the one to go for in the first place, because this one will treat absolutely everything. Thank you very much, everybody. In the back of the room, I have also left very few, but a few of these for anybody who is particularly interested in what we do in the clinic. Everything is in this little handout, but I didn't take too many because I don't like to waste money. And as I say, I will leave the gift vouchers with Judith, or if anybody has any questions, you can come and talk to me, and you're very welcome to take a gift voucher with you. And in the back of the room, we have your exercise programs. 10 minutes maximum every day. This is going to work. Thank you very much.
Any questions?
Hi, Judith. You just sit down, you guys.
When have you known me? Sit down and be quiet.
This is very true. This is very true.
Thank you for saying never, my dear. This isn't a question. I would just like to say, as some of you know, because of a condition I have got that's fairly unusual, I need maintenance on a regular basis. So I go to see Gay for the treatment she gives me. I've also had PRP. Most of you will remember I had a rotator cuff injury that wasn't responding to treatment. This was before I knew Gay, before she even came to Thailand. And I was seeing somebody regular in Bangkok, a doctor there, and 7 months, nothing worked, and I had this arm in a sling, and then I had this arm in a sling. I had PRP, and the very next week when I came to the club, I could lift my hand right up, my arm right up into the air, which was quite amazing. I've recently had PRP again, because I've had problems with my knees and and sciatica. And I have to say, the combination of PRP plus Gay's wonderful treatment, I mustn't call it torture, no, it's treatment. It works for me, it's definitely worth the money. It didn't work straight away with the PRP. I was in quite a lot of pain afterwards. But for me, on both occasions when I've had it, the pain has diminished, and I've had PRP in various places. That's my recommendation.
Thank you.
As an individual, not as a board member.
Any other questions?
Isn't that great? Everybody's well informed, so nobody needs to ask a word. Super.
They're all in shell shock, Gary, I think.
Because they have to exercise.
The thought of doing exercise. Maybe we should get somebody up to do exercise and show them.
No. What about you?
Huh? I've got a dicky knee.
Oh, that was always an excuse. Great. Thank you, everybody. It's been super.
I've got a question here.
Okay, thank you.
I've got a question here. On this side, on the left, I have a question.
Oh, you just slipped one in there, Albert.
Well, we're going to have one.
Unfortunately, mine wasn't successful. I went to your clinic.
Okay.
I can't really complain because I won here at the meeting. I won a treatment. It was actually 4 treatments. I went through the parabolic tent for an hour to increase the oxygen in me, and I had PRP as well, but I still had the same complaint. It hasn't improved at all. I'm sorry to say that, and I don't like to do that really, but it actually hasn't worked.
It won't work for everybody. Nothing does in this world, unfortunately. It will work for grade 1 or 2 arthritis. Grade 3 or 4, you may have to have the fat cell therapy. But it's always worth trying the PRP first, because it might be successful and it's the cheaper option.
Okay, thank you for your
Thank
help.
you.
Thank you. Where in Ireland do you come from?
I come from Navan.
Oh, I come from Malahide.
Oh, lovely, the posh end of town.
Any other questions?
Yes, could you just give us the name of the spray that you recommended? For
Uniren. U-N-I-R-E-N. Uniren.
We've had a run on the exercise sheets. We've got people queuing up in the back. Where are they? Where are they? So could you send some more next week, or send a website link to where they can get to see those?
Yeah, I made those up myself, so I'll photograph them and send them to you.
Okay, cool. Yeah, and we can have them attached maybe to the email next week. Maybe.
Do that, no problem. There's a spare sheet brochure up here if somebody needs that.
One last chance. Any other questions?
Going. Done.
Go. Okay, please thank Gabriel. And I'd like to present you with this certificate of appreciation from the club for your wonderful talk on how to avoid back pain. Oh, we've got to go in the middle here for the photograph.
Can I stand tall?
Oh, yes, you can stand.
Big, small.
Thank you, Gail. Thank you. And one more. Jim Jones, we haven't forgotten you. Please come here. A very special thank you and appreciation for a Marine on Remembrance Day and Veterans Day. Thank you, Jim, for your talk and your contribution to your country. Thank you.
I think Roger Fox did this last year, so I'm following Roger's tradition. Can everybody who served their country please stand? Everybody who served their country in some way, please stand. Oh, not me. Thank you for your service.